What's amazing though, and what I see oftentimes is that, training continues past you being an MD, right? And so many neurologists actually probably, I think it's actually the highest percentage of any specialty across the United States are also carrying out scientific projects, and they have the highest funding rate at the NIH, right? In my mind, the most complex system in the body. If you just think about connections, it's, many billions and trillions of connections throughout the neurons in the brain, and how those connections and how we decode those connections to the body and how the body sends signals back up to the brain is my area of focus. But the interpersonal communication is very much the same, I would say. So a neurologist, you get to know your patients, right? You get to know them for many years, right? And as an interventional pain doctor, I get to know I know patients for like 15, I guess 16 years now, right? So there's this clinical continuity, we call it continuity of care, where you see your patients continuously. That's not necessarily the case with other clinical professions. So very good at diagnosing things as a neurologist, but the treatments are lagging, I'd say. Every year there's new treatments, but there by no means is anything curative at the moment. So there's a huge opportunity to study these diseases and figure out what are the best ways to come up with new treatments, right? Or new ways to diagnose somebody so that you can treat them appropriately. Neuroscience literature focuses on brain imaging. So we do functional magnetic resonance imaging, where we look at areas in the brain. In real time, we can see, what your thoughts are. Like, where is the blood act? Where is there more activity or metabolic activity when you have a certain thought process? We study pain and trauma. Um, and then there's even decoding thoughts, like images. Like if you were to imagine a certain image, we have different artificial intelligence classifiers that can reconstitute that image just from your thoughts, right? So there's really amazing work that's out there. If you've ever had an MRI or seen an MRI machine, you go into a big tube with spinning magnets that looks at the hydrogen atoms and how they spin in your brain. That tells you how much activity is in that area in the brain. We also look at EEG, right? So if I was in clinical neurology, if somebody's having a seizure, I would use an electroencephalogram to look at that seizure activity with EEG. And the more advanced system is called magnetoencephalography. So in this case, we put you into a room that is completely sealed off from the rest of the world magnetically, right? So, and we measure the magnetic changes in your brain that are indicative of that activity in the brain. But across all different types of study, neuroscience, neurology, neuropsychiatry, we all use the similar tools to analyze the patient's.
Well, now that you've told us about like your career in neurology, could you tell us about like the brain's components and like their functions?
Can give you a overview of different, I guess, lobes. It's the most complex thing in the universe that we know of, right? Think about the brain in different lobes, right? So there's the frontal lobe that sits behind your forehead. Right? You have an area in the brain called the hippocampus, right? That's deep in the brain. And then you have the prefrontal cortex, which underscores this working memory, right? So there's immediate memory that's allowing us to take in information, remember it right now, right? That memory is then sent to the hippocampus that encodes all memories, right? It's very close to another structure called the amygdala, okay? And so the amygdala is a area of the brain that we consider the fear focus, right? The prior memories that are stored in your hippocampus cause new learning that allow you to then be able to respond appropriately based upon what tools you have to use, right? The other part of the frontal cortex is the motor section, right? So, and the capability to move my hands.